Fracture and/or dislocation treatment. Fracture and dislocation treatment codes appear throughout the musculoskeletal system section. These codes are categorized by the type of treatment: closed, percutaneous, open, and type of stabilization, fixation, immobilization. There is no coding correlation between the type of fracture dislocation, e.g., open compound closed, and the type of treatment, e.g., closed, percutaneous, open provided. For example, a closed fracture may require open treatment. Fracture dislocation treatment definitions. Manipulation. Reduction by the application of manually applied forces or traction to achieve satisfactory alignment of the fracture or dislocation. If satisfactory alignment reduction is not maintained and requires subsequent re-reduction of a fracture or dislocation by the same physician or same qualified health care professional, append modifier 76 to the fracture dislocation treatment code. Traction. The application of a distracting or traction force to the spine or a limb. Skeletal traction includes a wire, pin, screw, or clamp that is attached to penetrates bone. Skin traction is the application of force to a limb using strapping or a device that is applied directly to the skin only. Closed treatment. The treatment site is not surgically opened, i.e., not exposed to the external environment nor directly visualized. Closed treatment of a fracture dislocation may be performed without manipulation, e.g., application of cast, splint, or strapping, with manipulation, with skeletal traction, and/or with skin traction. Casting, splinting, or strapping used solely to temporarily stabilize the fracture for patient comfort is not considered closed treatment. Percutaneous skeletal fixation. Treatment that is neither open nor closed. In this procedure, the fracture fragments are not visualized, but fixation, e.g., pins, screws, is placed across the fracture site, typically with imaging guidance. Open treatment. The site is opened surgically to expose the fracture dislocation to the external environment for treatment, or the fracture dislocation is treated through the traumatic wound or an extension thereof, or is treated with an intramedullary nail or other internal fixation device placed through a surgical exposure that is remote from the fracture site with or without direct visualization of the fracture site. External fixation. The use of pins and/or wires that penetrate the bones and interconnection devices, e.g., clamps, bars, rings, for fracture dislocation treatment. External fixation may be used for temporary or long-term fracture dislocation treatment. Uniplanar external fixation places all the pins in approximately the same plane but may also include triangular fixation across a joint. Multiplanar external fixation uses transosseous wires and threaded pins placed in several planes that are held with interconnected stabilizing and/or tensioning rings and/or half rings. External fixation may be used for all types of fracture dislocation treatment, i.e., closed, percutaneous, open. Codes for external fixation are reported separately only when external fixation is not listed in the code descriptor as inherent to the procedure.